Sustainability of Aged Care by Siobhan Webster. The median age of the Australian population has increased by 2 years over the past 20 years. In 2017, approximately 3.8 million people were aged 65 years or older. This number steadily increased since 1927. The most significant increase in population growth is in the age group aged 85 years and older. The number of people aged 85 years and older has increased by just over 117% compared with a total population growth of fewer than 35%. The federal government established the Royal Commission into Aged Care Quality and Safety in October 2018. Baseline findings forecast increasing demands for residential aged care, home care packages and the Commonwealth Home Support Program. There is a considerable debate about whether living longer brings better health or whether people will be having the same levels of impairment. The data identifies 5 levels of functional limitations: non-mild, moderate, severe and profound, with the onset of dementia being especially problematic. Dementia is the second leading cause of death in all Australians behind heart disease. Projections indicate that approximately 1.2 million Australians will be living with dementia without a cure by 2059. Costs associated with dementia are not from years lost through early mortality, rather than economic and social burden of long-term care of patients. Governments and the community have long accepted traditional models and the waiting to die approaches. New technologies could be vital in unlocking sustainability in the aged care sector and increasing satisfaction among the elderly. Several countries are trialling the use of social robots and interactive therapeutic devices to minimize isolation and depression for those living in aged care. One widely used device for the elderly is PARO, an animatronic first-year pup. Prior and post-interventions with PARO patients exhibited low levels of participation in their environment. After patients interacted with PARO, there was a significant change in behavior where patients then exhibited high levels of participation in their environment. However, PARO cannot be a replacement for human contact or care. Another study in Japan observed how the elderly interacted with 2 different desktop robots, a physical robot, Commu, and a virtual robot, virtual Commu. The Japanese study found participants engaged comfortably in social conversations with Commu more than its virtual counterpart. Researchers found that participants assumed robots with a physical body could more easily respond and had more significant social ability. However, dementia patients will require programming changes on the Commu and virtual Commu units. Patients and healthcare workers in a Dutch aged care facility study evaluating the effectiveness of another robotic system, Zora, reported a more sustainable and enjoyable environment for all those involved. Researchers use Zora in group settings including movement rehabilitation, memory training, entertainment, singing together, dancing, or games. Healthcare workers believe Zora provided added value for patients in these instances. However, dementia-specific software would be required if Zora was to be adopted as an aid to slow the onset of this condition. This policy recommends the introduction of interactive therapeutic robots into all aged care facilities in Australia by 2030. Initially, costs would be associated with the purchase of the robots, staff training, and ongoing IT support. Under this policy, each facility will receive a minimum of 1 therapeutic robot. PARO costs approximately $7,800 per unit, and Zora costs $18,145. Funding for this policy aspect could be drawn from an annual budget in these areas, though there could be also special federal assistance for this initial rollout. The traditional model of work, retirement, selling the family home and moving into aged care is no longer feasible or sustainable for individuals or governments. Investing now in a policy supplying therapeutic robots to address the needs of dementia patients could provide part of this solution. The challenge will be to ensure therapeutic robots do not replace human interaction or be used to babysit dementia patients.